Good afternoon, everyone. Today we'll be looking at monitoring labor using the labor care guide. I guess Sister Victoria has taken you through the management of labor by stages. So this afternoon we'll be looking at how to monitor labor using the labor care guide. Our overview. The labor care guide is a new tool which the WHO has put together and has recommended for the intrapartum care during our practice. It helps us as skilled birth attendants to provide woman-centered, safe and effective care to optimize the outcome and experience of childbirth for every woman and her baby. This creates a positive feedback and decision-making loop as us, the healthcare providers, are encouraged to regularly assess the woman's well-being and her baby, record their observation, check for the signs that breach the threshold for healthy and well-being as labor progresses, and also to make plan as to care for the woman in consultation with the woman during labor. The aim of our labor care guide, it guides the monitoring and documentation of the well-being of women and their babies during the progress of labor. It also guides us, the healthcare providers, to offer supportive care throughout the labor process. And then it helps us to identify and address emerging labor complications by providing reference thresholds for labor observation that are intended to trigger reflection and specific actions. It also helps us to prevent unnecessary use of intervention during labor, meaning when to use antibiotics, when not to do VE, the like. And it helps us to support audit and quality improvement of our care during labor. Why the labor care guide? Remember, we are using the pathograph. Now we are talking about the labor care guide. Why? Because it was developed to improve every woman's experience of childbirth and to help ensure the health and well-being of our women and their babies by facilitating the effective implementation of the WHO intrapartum care recommendations. The labor care guide as a tool is established essential for good quality and evidence-based clinical care in all settings. All settings meaning a primary setting, the secondary setting, and the tertiary setting. And it expands the focus of labor monitoring to non-clinical practice that promotes a positive childbirth experience for every woman and her baby. For whom should we use the labor care guide? The labor care guide as a tool has been designed to care for women and their babies during labor and childbirth. It includes assessment and observation that are essential for the care of all pregnant women, all regardless of their risk status. However, this labor care guide was primarily designed to be used for the care of apparently healthy pregnant women and their babies, meaning women with low-risk pregnancy with less associated complications. High-risk women may require additional and specialized monitoring and care. When should we initiate labor care guide? As a document used in labor, it should be initiated when the woman enters the active phase, the first stage of labor. That is 5 centimeters. Sister Vic must have told you how to monitor the progress of labor during the first stage. And this stage is divided into two. We have the latent phase and the active phase. So this tool is actually used during this active phase at 5 centimeters of cervical dilatation, regardless of apparity and the membrane status. So meaning whether the membranes are intact or ruptured, we can still use the labor care guide to monitor the progress. Regardless of the woman's parity, whether gravida 1, para 5, we still need to monitor the progress of labor using the labor care guide. Although labor care guide should be initiated during this latent phase of labor, it is expected that every woman and their babies are monitored and that they receive labor care and support during the latent phase. As I was saying, the latent phase is from the onset onto 4 centimeters. It's not because you are not going to use the labor care guide, meaning the woman don't need your attention. As a midwife, you must be by this woman and provide her support and care whilst in labor. And when it is 5 centimeters, you want to start the labor care guide. Once you start this labor care guide, you will support the continuous monitoring throughout the first and the second stage of active labor. Now let's look at the labor care guide as a structure. A graphical tool that we have with us, WHO Modernized Pathograph, also known as WHO Labor Care Guide. This labor care guide has 7 sections, which has been adopted from the previous pathograph. Before now, we are using the pathograph to monitor the progress of labor. With this modernized pathograph, we now have an inclusion of the support system and the shared decision making. So this tool as a graph has 7 sections. Section 1, which is the identification, information, and the labor characteristics that we record on this part. And section 2, we are recording the support care that we give to this woman during labor. Section 3 is the care of the baby, the fetus in utero, the well-being. And then section 4, we'll talk about the woman, how we monitor the well-being of this woman whilst in labor. Section 5 is the actual progress of labor. What is happening from the onset onto full dilatation. Are there any medication given? Then we can record that in section 6, and the decision we make with the woman is recorded in section 7. Completing the labor care guide. On your screen, you see a draft of a completed labor care guide, just to show you a sample. How do we complete this labor care guide? You, the healthcare provider, should record observation for all sections soon after the woman is admitted into the labor ward. That is at 5 centimeters. Every observation made during that time should be recorded on this labor care guide. The remainder of the labor care guide is then completed following subsequent assessment throughout labor. For all observation, there is a horizontal line axis for documentation of corresponding time observation. So each time here, as we move along, I will explain to you the detail of this. Each timeline, you now record your observation horizontally. And then you have a reference that is on the vertical line that you must record and compare whilst you do your assessment. The labor care guide also provides a second stage. This was missing on the pathograph. So this is also an additional part of our care guide. So we now monitor the second stage to continue the observation made during the first stage of labor. Completing our timeline. If you look at the graph below, this is how it is on our labor care guide, our timeline. If you do your assessment, it is recorded hourly. So you do your assessment, for instance, at 6:30, and the second and third assessments are conducted 1 and 2 hours later. You document at 7:30 and 8:30. This should all be recorded in the respective column, meaning you don't cluster them. In each of these columns is representing an hour. So you document it every hour. So if you are to do 6:30 and then the next will be at 9:30, you document under 9:30, not under 7. It's an interval between our care guide. Now let's look at how to fill the labor care guide by section. Section 1, identifying information and labor characteristics on admission into the labor ward. This is the first section of our labor care guide. On this document, you document the woman's name, the name of the woman, the labor admission characteristics that are important for labor management, like the parity, how many varied delivery has this woman got, the mode of the onset of labor. Was it spontaneous? Was it induced? What was the onset like? You document. And then you want to document the time of active diagnosis. Remember we said labor can start from the latent phase. But when was it active? The time is what we put the actual time of active diagnosis of labor. Rupture membranes, the time and the date. And then the risk factors. What are some of the risks that will complicate this pregnancy if not managed correctly? You outline them to guide the process of management. These are 4 sections. Now let's talk about section 2 of our labor care guide, which is the supportive section. This section, remember, we are talking about respectful maternity care as a fundamental human right for all women in labor. And that is why WHO has brought the labor care guide to complement this effort to bring respect to our women. So section 2 of our care guide is giving support to the woman in labor. It aims to encourage the consistent practice of respectful maternity care through the continuous provision and monitoring of supportive care. In this section, it includes labor companionship. Were there anybody that accompanied this woman from her social network into the labor ward? If yes, then you will indicate with why. If no, then you know you need a birth companion. You also want to check if there was any pain relief given during labor. Was there any? Both pharmacological and non-pharmacological pain relief. If there was any given, you indicate with a yes. If no, then you will say no. We'll give you the keys. And sometimes the woman might say, no, I don't want. And that means the woman has declined the offer. You may put D. She doesn't want any. You also want to look at the woman taking oral fluids. This is exception from IV fluids. Whatever fluids, water, juice, tea, that will help her sustain her strength during labor. You indicate with a yes. If she hasn't got any, then you will say no. If you offer her a drink and she refuses, you may want to indicate with a D, saying the woman has declined the offer of oral fluids. And then you record the technique to improve women's comfort, one of which is the mobility of the woman during the process of labor. Is this woman moving around? If she is mobile and willing to walk around, fine, indicate with an N. If she is not walking around, she is in the supine position, then you indicate with an SP. These are the thresholds. Section 3 of our labor care guide is the care of the baby. Care of the baby in utero. This is designed to facilitate decision making while monitoring the well-being of the baby. The well-being of the baby is monitored by regular observation of the baseline fetal heart rate. What is the baseline? The deceleration of the fetal heart rate and the amniotic fluid, the fetal position, molding of the fetal head, and development of the caput suscetum. When you look at our labor care guide under this aspect of section 3, the threshold gives you the guide. What is the baseline heart rate? Normally we look for 110 over 160. But if the heart rate goes below 110, it's an alert. It has gone beyond our threshold. Something needs to be done. If the heart rate goes above 160 or is equal to 160, it tells you from the labor care guide that something needs to be done. You need an intervention. So this is why the threshold is there to guide you against your observation made during labor. The care of the woman in section 4. This facilitates decision making for consistent, intermittent monitoring of the woman's well-being. The woman's well-being are monitored on the labor care guide by regular observation of the maternal pulse, blood pressure, temperature, and the urine. Also, we said there is a threshold that guides us. What is the maternal pulse during this course of labor? It should not be less than 60, not greater than 120. So if you do your observation and you realize the maternal pulse is going above 120, it's an alert. As a midwife or care provider, you need to think of what to do. What of the blood pressure? Assessing the blood pressure, looking at the systolic blood pressure and the diastolic blood pressure. Remember, a woman in labor needs to be monitored regularly for a fluctuation within their vitals. So look at the threshold as against the observation we make. The labor progress, section 5. Section 5 talks about the progress of labor, which aim to encourage the systematic practice of intermittent monitoring of labor progression and its diameters. The labor progress is recorded on the labor care guide by regular observation of the frequency and duration of contractions, the cervical dilatation, and the descent of the fetal head or the baby's head. Now let's talk about this section. It's most important as much as all other sections are important. For the labor care guide, for us to interpret effectively, we need to look at these 3 parameters: the dilatation, against the contractions, and against the movement of the fetus in utero. If we have a contraction less than 2, when the cervix is already 5 centimeters dilated, it's an alert. Something needs to be done. Now we have contractions against the descent of the presenting part. If there is contractions and the dilatation of the cervix commensurate with the contraction, we are expecting the head to descend. And if it doesn't work, then you need to take action. That is what we'll be discussing when we go into our skills. Section 6 of the labor care guide talks about medication. This section will record all types of medication used during labor by describing whether the woman is receiving oxytocin. When we say oxytocin, remember, it's not evident that we must always give oxytocin. You may use carbetocin, heat-stable carbetocin. You may have used misoprostol. So all of these are oxytocin drugs. You can still record under. And it does in dosage, how many milligrams, how many micrograms, and whether other medications like IV fluid are being administered. Section 7, shared decision making. It aims to facilitate continuous communication. Remember section 2, we talked about respectful maternity care under supportive care. So we cannot make a decision for this woman without her being involved. So we now communicate with the woman effectively as with her birth companion, and the consistent recording of the assessment and plan with her in agreement. So WHO recommend effective communication between you, the midwife, and the woman in labor and her birth companion, including simple and culturally appropriate language. Remember, our aim is to inform this woman, then get her consent, and that will not be done with language that the woman cannot understand. So it should be in a simple or culturally sensitive language for the woman to understand. Clearly explain the procedure and their purpose should always be provided for each of these women. The findings of your physical examination should be explained to the woman and her companion, and the subsequent courses of action should be made clear to enable a shared decision making. So, we want to talk about the nomenclature to complete the labor care guide. Where a measurement is numerical, actual numbers should be recorded, like we have for the blood pressure, 110/140. So we record the actual number of the blood pressure. Documenting non-numerical observation, that is based on observation, not based on counting. A list of abbreviation is presented. We'll look at them on our next slide to allow consistent interpretation of the alert line. These are the abbreviations we're talking about. For instance, where you have the rupture of membranes, date and time, and the woman could not give you exactly the date and time that you should record in numbers, then you will put U to say it's unknown. If in section 2, for instance, we talked about birth companionship, if the woman came in with a birth companion, she was allowed into the labor ward, you record with an yes or Y just to say yes, there is a birth companion. So these are the non-numerical documentation we put on our labor care guide. The list of them follows in the next slide. Now I want to complete our labor care guide by section, as in skills. So on your screen, you will see a case scenario. And so far, we have come to the end of this presentation. We want to now take the scenarios to plot it on our labor care guide. So the information is on the screen. We'll now translate what we have on the screen into the labor care guide by section. That means we're going to take it section 1 through section 7. Thank you so very much for your attention. If you have any question, you can drop it on the comment section, and hope to see you again the next time with our labor care guide. Thank you very much and have a blessed day. I am Sister Cicilia. Hope to see you next time as we complete our labor care guide.